that will negatively impact disabled Nova Scotians. And our panelists are here to speak to this issue. So our first panelist is Claire McNeil, who is a lawyer at Dalhousie Legal Aid Service. Our second panelist is April Keddy, who is a woman who lives in Port Williams and is directly impacted by these amendments. Our third panelist is Dr. Margaret Casey, who is the chair of the North End Community Health Centres Board and is involved in a number of other community issues. And we also have Dorothy Kitchen, who is one of the founding members of the Disability Rights Coalition. And Ms. Kitchen is not speaking as a panelist, but will be here to answer questions after the presentations. Thank you all for being here today. And just to let the press know that there will be some time after the presentations for questions, and our panelists are available for interviews if you so desire. So let's start. And Claire, I'll turn it over to you.
Thanks, Fiona. For members of the press who are here, we have press kits available. They look like this. They're at the back. You see them there. And in the press kit, I think you'll find some useful material. At the very back, we've also taken the unusual step of including the actual provisions from the regulation that have been changed. So you can see with your own eyes the sections that have been repealed. So there's two parts to that. One is the Order in Council that actually made the changes. And then we've also included a single page with the repealed provisions, so you can see what's no longer there with your own eyes. And I think that it's an unusual step, but I think it's important in this situation because we want everyone to come away with a true picture of the nature of this cutback. So I'm really pleased to be able to be here today and talk to you about this issue. When I heard about it on the media, like probably the most of the rest of you, and was really taken by surprise. Surprise because there had been no advance notice or opportunity like for public consultation, or and we've since spoken to others, and it really appears that health and disability rights groups were not contacted or consulted prior to this change. And I guess we were also disappointed because I think, we have seen some positive steps and positive changes from this government in the last little while. They have made some small increases to the personal allowance, and they've done some stuff to improve supports for people who want to go back to work, and they've come out with an affordable living tax credit. So there have been positive changes. So we were really disappointed and really discouraged to see this change because we think it represents a couple steps, at least a few steps backwards in terms of making sure that we have good programs that respond to the needs of people with disabilities and serious health conditions. So that's kind of like a bit of the backdrop, and you're probably all wondering when I'm going to get to the point and talk to you about what do the changes represent. And so I want to talk about the impact. And in a global sense, what has happened is we see a program that basically had two parts to it. So I think the first thing that should be said is that if you are getting special needs according to a list, under a list that was provided by regulation, your situation is unchanged, and you will continue to be eligible and continue to receive assistance for those needs that fit within the list. What we're here to talk about today is the second part of that program, and that program provided for assistance for essential health services or services to alleviate pain and suffering. And it was, second part of the program was designed to address the distinctive needs of people with disabilities or serious health conditions. It recognized that there was a need for accommodation, and that there was a need to make sure that programs responded to the distinctive and different needs of people in our community who couldn't afford to pay for the cost of their own health services. So that is gone as a result of these legislative changes. And that's a very serious and negative consequence that we want people to be aware of. I think the other aspect to this is that I guess the government has said that nothing has changed, but really this program did provide for a whole range of services that are now no longer available. So it wasn't just limited to medications or prescription drugs. It included all non-insured services that were not insured under MSI. So it extended to things like psychological counseling or physiotherapy or massage therapy, other things that now people are going to have face roadblocks in terms of accessing the services that they need to maintain their health. And I think it's really important to recognize that this program is really a last chance for people. It was designed for people without any other options. So this morning on the radio, those of you who may have been listening would have heard about Adrienne DeYoung, who has MS, and she struggles with extreme symptoms from her condition. And her doctor, having tried every other alternative, recommended a course of treatment and a medication to address some of those symptoms. And Adrienne's case is a case that makes it clear that this particular piece of the special needs program was designed for people when there was no other effective alternative treatment or program available. So Adrienne had described her situation. She's on CPP disability and she couldn't afford to pay herself for the cost of this medication. And so she was able to apply under this program for assistance and receive the essential health services that she needed. As a result of the change last week, that program, those services will no longer be available. In another case, from a few years ago, Sandra McKeegan's case, she's a woman who had, a young woman with healthy teeth who unfortunately suffered from serious gum disease. And she needed surgery to treat that problem, and it was recommended by her doctors. They were able to show that there was no other viable alternative treatment. She was not a suitable candidate for dentures, and yet she was refused. The Department of Community Services said, you don't fall within the list of our covered dental procedures, so we can't help you. But there was this provision, there was this piece of the program that gave her the ability to go to the board and say, this is an essential health services. Department of Community Services solution was to say, well, have all your teeth pulled, at a young age. And the board said no, that was totally unreasonable, and that the Department of Community Services needed to provide essential health services, and they were ordered to do so. We know of other cases where people have qualified for psychological treatment that's required as a result of post-traumatic stress disorder. And as we know, psychological counseling and treatment is not covered under MSI insured services. And so people who are living in poverty, who had no other alternatives, were able to go to this part of the special needs program and qualify for assistance. And as a result of that change, those services, those treatments will no longer be available. So we think that this is a very negative and very unfortunate change in the special needs program. So what we're hoping today is just to educate the public about the implications of this change so that they understand that there has been this cutback to essential health services and services necessary to alleviate pain and suffering. And we're hoping that, the way we see it, and from a review of the cases in our office, we know this is going to hurt people with disabilities. It's going to hurt people with serious medical conditions. And that's who's going to feel the effect of this cutback. So we want to educate the public because we don't think that the true picture has come through thus far in the media about the implications of this change, and we think that needs to happen. And we hope that once people know what's happening, we hope that they will contact their MLA or the Premier's office and let them know how they feel about this. And we also hope that the Premier and members of Cabinet are listening. and that they're going to take immediate action to correct this mistake, what we see as a mistake. In the longer term, we hope to work with government to create a stronger human rights framework for dealing with these problems. So one of the very unfortunate things about this change is that it removes political and legal accountability for this kind of decision. It takes away a program and replaces it with a list or a policy that does not reflect people's true needs, that's not accommodative of disability, that is discriminatory. And we think that that's a really regressive move to take at this point, and we want to work with government to create a much stronger system for legal and political accountability to make sure that this doesn't happen again. So those are my comments. And now with us is April Keddy, and April has come today from Port Williams to join us, and she's prepared to speak about some of the direct consequences of this change.